I am good. Absolutely a pleasure to be in front of the BASIS team today. We are going to talk about burnout, compassion fatigue, and secondary trauma. So my apologies, I sent the wrong agenda. So I'm just going to share my screen so you guys have the correct agenda.
Okay, and you're just going to tell me whenever you want me to speak up, right?
Okay, yes.
So you just need to prompt me then.
And can everybody hear me okay?
How are you?
Yes, ma'am.
Good.
Yes, we can hear
I
you.
struggled a bit with my technology.
Absolutely fine.
Okay. Give me a second. I'm going to share.
Okay. Hello, ma'am. How are you?
I'm good. How are you?
I'm fine, ma'am.
Very good. Okay. Can everybody see my agenda?
Yeah, ma'am. We can see it.
Yes, ma'am.
Wonderful. Okay. I just want to touch on what we're going to talk about.
Okay.
We will first define and differentiate the terms secondary trauma, compassion fatigue, and burnout. Then we're going to identify the signs and symptoms, describe the impact. There's an assessment tool I want to share with you. We're going to identify the mechanisms of prevention. We're going to have questions and answers, and then we will conclude. But
Okay, ma'am.
before I get into all of that, I just want to thank you. Thank you, Madam Javahar, so much for inviting me to speak in front of your team. And thank all of you because it's the end of your day and you decided to come here and listen to me. So, and I appreciate that.
We are so happy to have you on board, and
Yes, ma'am.
much for doing this.
Thank you, ma'am.
Oh,
Thank you.
Welcome.
Thank you, Miss.
Okay.
Thank you so much.
I hear everybody. I kind of can. I think I can make who is who, so it's okay.
Assalamualaikum, ma'am Jawahar.
Hi, everybody.
कैसी हैं मैम आप?
I'm okay.
Assalamualaikum, ma'am Shumaila. कैसी हैं?
Assalamualaikum, Maruf. I'm good. How about you?
I'm fine.
Okay. And you guys, what you see right now is my screen, correct?
Yes, ma'am.
Okay. So again, I wish I could hopefully I'll get to know everyone at some point. I don't have enough time to go through everyone's introduction, so I'll tell you a little bit about myself. I am Dr. Nasiah Cirincione-Ulezi. I am a board certified behavior analyst right here in Illinois, United States. I have been in the field of disability services now for 30 years. 2020 marks my 30th year in this field. So hopefully, you know, you will all share from the experiences that I have had over the course of my career. So let me just do a quick assessment. Can you tell me, what does everybody know, especially in terms of your own culture? What do you know about secondary trauma, compassion fatigue, and burnout? Have you heard those terms before? Anybody? Okay, so is it fair for me to assume this is new? These are new terms for you?
Ma'am, excuse me. Hello, hi. I'm Shakila Amin. I have a little bit information about burnout. This is when the employees are exhausted from their work.
Absolutely. That is absolutely. There's a component of emotional exhaustion and also physical exhaustion. So let me pull up my slide, my presentation. Now, right now, is what's being shared the presentation with everyone? Is that what you see?
Sorry for the interruption, but we cannot see any slide. We can see on the screen where you have folders. Like this is March
Oh,
25th
okay.
agenda
Hold
and
on. Let me go
pro
back.
or something.
Okay, are we there?
No,
You
No,
still
ma'am.
can't see it?
no, I just
No.
folder. I think you have to minimize the folder.
Hold on. Okay.
And then share the PowerPoint, I think.
Let's try one more time.
There you go.
We can see, ma'am.
Awesome. Wonderful.
Yes, we can see.
Okay. Okay. We are going to talk about the three: secondary trauma, compassion fatigue, and burnout. What I want to do is really focus on the burnout, because the secondary trauma and the compassion fatigue, they're all different, but everything is going to lead to the burnout. Okay, let's kind of drill down on the term secondary trauma. And to be honest with you, like I said, I have been in the field for 30 years. I really did not start hearing this term until around probably 10 years ago, but it makes sense. So the secondary trauma are the feelings and behaviors that result from the indirect exposure to trauma by helping or wanting to help someone who has been traumatized. So in other words, there are feelings associated with you not just experiencing trauma firsthand, but when you watch someone go through a trauma, when you watch someone go through a very difficult experience, when you see someone traumatized, that impacts you also. Is everyone following what I mean by that?
Yes, ma'am.
Yes.
We do.
Ma'am. Yes,
Yes,
ma'am.
ma'am.
Wonderful, wonderful. A lot of people think, well, it's happening to that other person. It really doesn't have anything to do with me, but that's not it. What we know from the research now is when you witness others go through trauma, it can be as real as if you're going through it yourself. So I want to just take a couple minutes. Just take a couple minutes and do some reflecting on you as a practitioner, because my understanding is everyone here is working for BASIS, so you're all working with children and adults with special needs in their families.
Yes, ma'am.
Yes.
Yes, ma'am.
Exactly.
Okay, so just think about that. Now I know, I am not in Pakistan, and I've actually never been to Pakistan. Hopefully someday that will change.
So you're going
But
slow.
I believe there could be some commonalities with some of the things that I see here in Illinois, and you can see while working with families. What are some of the things that you could describe as very difficult to see families go through in your work? Do I have a volunteer who can share? Don't be shy. I like to share. I can tell you in my own work, I see a lot of poverty. I see a lot of families who are trying to help their child with special needs, and they don't always have the resources to do it effectively. And that is very painful for me to see. And in a lot of, it causes me great distress. And if I don't constantly revisit it in myself, it can lead to burnout. Okay, compassion fatigue. This is another pathway to burnout. And compassion fatigue is a state where the person who is helping traumatized people becomes preoccupied with those people by re-experiencing the traumatic events, avoidance, numbing of reminders, persistent arousal and anxiety. Compassion fatigue serves as a function of bearing witness to the suffering of others. And again, closely related to secondary trauma. I look at compassion fatigue as almost a post-traumatic stress. Is anybody familiar with that term?
Yes, ma'am. Yes, ma'am.
Yes, yes, compassion fatigue. Again, we're working with people who behavior can often, it can be very difficult. And when we're working with these families, with these children, we can often become overwhelmed and sometimes preoccupied with their struggles, their problems. I mean, if you think about it, that's why we go into this field. We go into this field because we want to serve and we want to help people. But if we don't really maintain good boundaries and we do become overwhelmed or preoccupied with the struggles, it can affect us and it can lead to burnout. Okay, and the last piece here, the burnout. This is the big one. Burnout, and somebody already said it, exhaustion. But it's not just a physical exhaustion, it's an emotional exhaustion. It's a reaction to the chronic stress that involves negative interactions between the environment. And it's a chronic condition that develops when one is working too hard for too long in a very high pressure situation. I will tell you, in my 30 years of service in this field, I have experienced burnout, and it's not fun. So what are the signs and symptoms? And this is where I want everyone to really, really go inside, because the signs and symptoms can be very, very personal, and they're very unique to each individual person who's going through the burnout. It can be nervousness and anxiety. Some people are angry and irritable. Others have mood swings, flashbacks, difficulty concentrating, a lowered self-esteem. The lowered self-esteem is interesting. Why might, if you're burnt out, why might you be suffering from low self-esteem?
This is the feeling that one cannot do the work properly, or might be he's not that intelligent or hardworking for the work. That's why he felt a less self-esteem, and he or she might withdraw from the work because of less self-esteem.
Absolutely. Excellent. That's it. Again, we go into this field. Why? We go because we really have a desire to serve, and we have a desire to help. So if we are in circumstances where we don't feel effective, just like you said, that is going to lead to a lower self-esteem. We won't feel good about ourselves. Feeling less trustful of others. When we are burnout, we don't have the ability to often see things as they truly are. And we don't trust people. When I was in the throes of burnout, I had a hard time trusting the people I work with, because whenever somebody would approach me, I would think they're just approaching me to give me more work. Again, it really skews our perceptions. Another thing that happens naturally when we get burnout is we withdraw from others. There can also be changes in appetite, sleep and other habits, physical changes. Some of us may suffer from depression. Some of us may self-medicate. And here where I'm at, when we think in terms of self-medication, a lot of people automatically go to drugs and alcohol. That's a real prevalent form of self-medication in the States. But let me tell you, I have also seen people self-medicate with food. I've seen people self-medicate with technology. I've seen people self-medicate with work. In other words, a lot of times, whatever we do in excess can be a form of self-medication to kind of distract us and help us cope with the burnout. But it's not healthy. And again, a feeling of self-entitlement can often come with burnout. So just take a couple minutes and sit with this, because this is important. The piece where we talk about the signs and the symptoms. And again, it's important because it's so unique to each individual person. Nobody, I mean, generally these are the signs and symptoms, but it can look different for each one of us. You know, when I was going through burnout, I don't think people would really know, because I was able to kind of put my, what we call my game face. I kept smiling, I kept working, but inside I was having a really hard time. And Madam Jabahar and I actually did this talk a few weeks ago for another group. So can you share your thoughts too on this slide?
Sure. So what I would like to say over here is that signs and symptoms are evident in all cultures and all ethnicities and all genders and all religions. When we talk about compassionate, fatigue, that's something that comes with everyone, everybody who's working with any kind of children, any kind of, in any field. So any field of, human service that we work with, which could be nursing, it could be as if we're a doctor, it could be if we're a social worker, it could be if we're a therapist, anywhere that we work, this is something that would come along with us. This term was found by Charles Figley. He's the one who went to war to work with veterans, and that's where he found out that, when he was working with the veterans, it started changing his personality, and when it started changing his personality, that's when he realized that there's something going on, and that's where he came up with this term. So, he came back, he did more research on it, and, there have been people who actually talk about this stuff. But the signs and symptoms that I want to tell you is that, we don't realize it, but slowly with the passage of time, it starts bearing on us. And when we talk about nervousness and anxiety, it comes and it shows in many different ways to our staff members. It just could be increase in your cigarette smoking, it could be increase in the amount of working hours that you're putting into your work, right? So how many of us have actually been working more and more because, that's the way of getting out of our depression. We are doing a lot of work, but, the quantity, we are taking a lot of work on, but the quality of our work is going down, right? Secondly, what we start seeing is a lot of self-medication. And I really want to emphasize over here on self-medication, because I know Dr. Nasiah is being very culturally sensitive right now, but I know, and you guys know, that there is a lot of alcohol going on in Pakistan. There's a lot of self-medication, which is Xanax, Lexotanil. All those pills are so common. And we say it or we don't say it, but those things are available. Drugs are even available. Recreational drugs are so common in Pakistan right now that most of us are going, and we are I'm not saying most of us, but yes, the trend is that people do go and get those drugs off the market, which includes like a very, very common drug, which is out there is ice, which is a synthetic drug, right? Kids are using it, other people are using it. And those are the worst drugs because, then that's what messes up your system. And then self-medication, alcohol, increase in smoking. These are all the things that you guys are doing in order to get rid of the symptoms that are wearing off on you, right? So again, for example, like anything that you do, which is going an extra mile for your client, is wearing down on you. And over here, when I was talking the other day about this, we talked about, if there's a client that is going through something, for example, okay, I had girls who were twins. I used to be one of their teachers. Unfortunately, they had gone through abuse at their foster families. So I had to go with them to the hospital. I had to stay till 2 a.m. in the morning. But then I realized, hey, I'm just a BCB. I'm not supposed to be doing this. But just looking at them going through that trauma is just very traumatic. I didn't realize it, but it wears down on you. And then when parents come to you day in and day night, they keep on texting you, they keep on talking to you. When is my child going to get better? Should I do this? Should I do that? That wears down on you. And at the end of the day, this is something that becomes, the compassionate fatigue. And, so anytime, I'll give you one example. I was doing research on it, that, one of the ladies who was talking about it was that she was a social worker and she was working with a mom. And the mom had gone through some, really rough times, and she had a child with autism. And she was coming and sitting and talking to the social worker and explaining her home life. And once she was talking about it, her phone rang, the social worker's phone. And she said that she had to actually put that phone off because she wanted to make sure that the message she's giving to the mom is that I'm listening to you. I am here and I'm listening to you. And she said that till now, the only thing I remember is every time the phone rings, I think of that mom. So now she has, she is definitely into the whole stage of the compassionate fatigue and because she is, relating herself to that incident. And that's the only thing she remembers. So anything that takes you back in those moments, which are the flashbacks, is also a sign and symptom of that. So you guys have to look for those signs and symptoms, okay? And I think that's about it for me, Dr. Nasiah.
Yeah, thank you so much, madam. That is great. And it's so true. Flashbacks are real. If you've been through a traumatic situation and then you're placed in a similar situation, you definitely, your mind wants to kind of keep you safe, and you will flash back. And thank you for enhancing the piece on self-medication, because we all do it. Okay. Okay, so what is the impact of burnout? And we talked a lot about this the last time we shared this talk. The big picture of it and why we want to pay attention to it is it does create apathy toward the individuals and families we serve. So if we are burnt out, if the staff that we are supervising is burnt out, they could very well end up not caring to the extent that's effective for their work. it impacts our relationships. It impacts our relationships with family and friends, but most definitely it is going to impact the relationships we have with our colleagues. Have any of you ever worked alongside someone who was suffering from burnout? What is that like?
Ma'am, if you have someone who is working with you and he is has burnout, he just gets irritable with you every time you want to talk to him or her, or he just don't talk to you with in polite manner at all.
Absolutely. That is absolutely right. When our colleagues or us, when we're burnt out, we are not great to communicate with. And if someone is irritable or short with you, you're going to try to avoid them. In our field, it doesn't serve us well, and it doesn't serve our families well to work in isolation. We have to communicate with each other and work together. So thank you so much for sharing that. The relationships with individuals and families we serve suffer. So think about the person who's experiencing burnout. How are they going to be with individuals and families? What is that going to feel like to a family who is already possibly under some very stressful situations? Families know, individuals know. When we show up and we're burnt out, they can feel it. They can feel it. So it's important that we keep a check on who's burnt out, because we could actually contribute to family stress if we show up and we don't show up with our all. So it's very important to understand that that's one of the most detrimental impacts of burnout, is how we show up in front of our families and our relationships with them. And again, you may leave your position and create additional workloads for your colleagues. How many of you have seen staff turnover as a result of people being burned out? I know here where I'm at, with our registered behavior technicians, we have the greatest turnover. And I know that it's directly related to burnout. What is the turnover like for your registered behavior technicians where you are in Pakistan or another country? Is it the same? Is there a high turnover?
Yeah, it's not so many RBTs are there in Pakistan, but I have not in our organization, fortunately not in basis, but I have witnessed so many organizations where the staff burnout is very high, because the workload is very high. Also, no performance appraisals are there, and very strict environment. So such kind of things, leads to staff turnout. So I've witnessed in so many organizations, even very well reputed and bigger organizations, that staff turnover is very high because of these situations,
Absolutely. Absolutely. Thank you so much for sharing that.
You're welcome.
Yes. And then when we are burned out, or when staff are burned out, the overall job performance is going to decrease. And that's going to impact positive outcomes for our clients, for the people we serve. You and our staff, we just don't work well and get results when we are burned out. You can't. So it is important that we all work to tackle this issue, because I've seen it. It's rampant in our field, and I believe part of the reason it's so rampant is because we do attract people who care, who really want to help. And sometimes You just have to put boundaries in place to help avoid the burnout. And I'll talk more about that in another slide too. Okay, what I want you to do, and can everybody see the screen nicely?
Yes, ma'am.
Okay,
Yes, ma'am.
this is a phenomenal tool. And what I did was I sent the scoring sheet to Madam Javahar. She will share that with you. But I just want you right now just to take 5 to 10 minutes to go through and answer it. And then Madam Javahar will send you the scoring sheet when we're done, and I want you to score it. So just take 10 minutes. I'm gonna step away just for a minute, for about 5 minutes, so you can complete this.
Can you
Okay?
please zoom it a little bit? Zoom in.
Yes. If let me see.
Ma'am Shumaya, we can zoom it in ourselves.
Oh, good.
If you try.
How?
Good.
Okay.
For example, ma'am, I have it on my mobile phone, so I just, zoomed it and it's doing
No,
it
it's
fine.
but I can do
वाला
it.
इसको खुद zoom कर लेंगे.
Okay, I'm gonna step away for just 1 second. I will be right back.
Ma'am Shumaya, if you're using the laptop,
Yeah.
मैम जो उसका जो माउस कीपैड होता है ना, आप उस पे जो है जो जैसे zoom in करते हैं ना, वैसे करें तो वो हो जाएगा.
If you don't mind, I have the PDF of the scale. I did the scale yesterday. I can share you in the WhatsApp group if anyone cannot see.
Oh, I have that also. Okay, thank you.
I can't see it. How do I zoom it?
There is an
That,
option
let me send you in WhatsApp.
Yeah, please.
There is an option right at the top of the screen where it's written that you are viewing doctor's screen.
Yes,
And then
yes.
there is view option. You click on the view option and then zoom ratio, and it's 100% original size, and then you adjust it accordingly.
Okay.
Oh yes, it's there.
Okay, Shumaya, thank you.
Just a couple more minutes. Okay, let's chat about the scale. Again, Madam Javahar, you will share the tool, because I sent you the scoring sheet, and I believe you already forwarded that to everyone.
Yeah, I did. It's
okay, wonderful. Just take some time, because one thing that I do know that when it comes to burnout, it's very important that we as supervisors, we address our own burnout to help staff manage it better. So just get a pulse on where you are as far as your own burnout, and then plan to do some things about it. It's very important, and I promise you, it will serve you well in your career. So thank you for doing that. I appreciate it. So what can you do? What can you do to avoid burnout? What can you do to address it? And when I speak of what you can do, is what you can do for yourself and what you can do for those that you supervise. Yesterday, I participated on a call with an individual whose passion is acceptance and commitment therapy. Is anybody familiar with acceptance and commitment therapy?
No, they're
No,
not.
ma'am.
I mean,
Okay.
but I don't think anybody else.
Okay. Well, you know what, Madam Javahar, I am working really hard to become fluent, so I have a lot to share. It's actually Scott Herbst is doing the call, and what he shared was, it is important when you're working to know what your values are. For a long time, what happened to me is I started working and I was working and I kept working, but I wasn't really in touch with why. Why am I working these long hours? Because if it's just for money, you're gonna burn yourself out. So what I've recently started doing, and with the help of this therapy, acceptance and commitment therapy, is starting to tap into what my values are, what my core values are around work. What I found out, what I love, is I love when I'm training and I'm teaching. To me, when I'm in that zone and I can train a family on a new technique or help them help their child, that's when I get fueled. That's when I feel really alive, and that's what excites me. And working from that place helps me to avoid being burned out. So check in with yourselves and check in with the people you supervise, your staff, to make sure they know what their core values are around their work. It's very important. Also, working with a purpose. Kind of, teaching with the end in mind, or working with the end in mind. What is your end game? What do you want to achieve? Another thing that I have really come into, and this is because I'm older, is making my own health a priority. Many of you, it sounds like you're early in your careers, you're younger, and at my age, younger is people who are under 40. I really urge you to make your health a priority now. Work, it can certainly be a blessing, but make your health. Good health is a blessing too. And with good health, I want you yourself and your staff, practice self-care. For me, my self-care is, in spite of everything that's going on here, I take my walk every day. I make sure I'm outside. I'm watching the food that I put in my body. I'm making sure that I take time to relax. It is so important. Another piece is exhibit compassion. Knowing that we are in times that are incredibly stressful. When your colleague, when your staff person comes to you and they're coming to you and they're irritable and upset, just take a minute to check in and say, I wonder what that person is going through that makes them behave in such a way. That is a way to exhibit compassion. Set a good example. as leaders, we have to make sure that the people who we serve can look to us as a guide for how to avoid burnout. And finally, for me, and this was kind of my list, I like to be a source of optimism. So again, we are in some challenging times. And one of the things that has fueled me is I've been able to make some YouTube videos that are optimistic. And I believe those videos are helping people look at the bright side of things. And for me, watching my thinking is helped me to avoid burnout. And again, Madam Javahar and anybody else on the team, please share what you can do to avoid burnout.
We can manage our time properly, like sleep time, food time, and we can have a leisure time, which is very important. We can meet our friends, we can talk to them, we can talk to our family members. This should be a part of our daily routine.
Yes.
And of course, healthy diets is very important.
Absolutely.
So these all things are very important.
I would like to say for to avoid the burnout, there are two that I have been doing. One is the time management, and the other thing is practicing mindfulness. Like we are Muslim, we do practice a religious obligation, but then there is one more thing, which is mindfulness. You could use any activity to do a mindfulness. So these are the things I have been practicing from last 1 year, and I suggest them.
I didn't hear everything you said, but I did hear mindfulness.
Yes.
Thank you.
Mindfulness and time management.
Mindful and time management. Absolutely. Thank you so much for sharing that.
Thank you.
Anybody else?
Just like you said, we can be a source of optimism for everybody. Like if someone is, if you see somebody is in trouble, like he is irritable or he has mood swings and all, we can just go and talk to her and just ask what if you can share your problem with us. Maybe we might be able to help you, and like we can do like a catharsis of that person, so that so then that person may be able to feel a bit relaxed, and maybe then he will be fine after that.
Phenomenal. Phenomenal. You guys, I want to be on the basis team. You guys have it.
Thank you, ma'am.
That's great. Absolutely. Please,
Thank you,
more
ma'am.
sharing.
Okay, ma'am. I guess you might be known to self-compassion. That is sort of like self-empathy.
Absolutely. Did you say self-empathy?
Yeah,
meditation.
Myself, like I can boost up my energy by knowing that I can do and I'm supposed to do that. So in that case, energy is boosted up and you are compassionating yourself. That helps to boost your self-esteem as well. And might be some chocolates and watching a good movie somehow.
Yes. Wonderful. Thank you. What everyone is doing is adding to my list. Thank you. More, please share.
When I am burnout,
Ooh, we got a little feedback. Hello?
Hello. So who's going first? Hello.
Yes.
So I would like to talk about, set a good example. Back in 2019, I was very stressed out, and I was just jobless. So one day, Ma'am Shumaila just called me, and she pushed me to do RBT course. So I did it under the supervision of the great Ma'am Jawahar, and she really set a very good example in my life. And I was literally very stressed out just because I have a circle of friends which were all MBBS, and I was just burned out that they are practicing medicine and I'm nothing in front of them. So then Ma'am Jawahar literally pushed me, and Ma'am Shumaila set a very good example in my life, and I am here in this field just because of them, because they really set a very good example in my life.
That
And I'm
is
very happy with my career.
That is phenomenal. Phenomenal. Thank you for sharing that. I love that because we do. We support each other and we inspire each other.
Exactly.
Yes.
Exactly.
Yes. Thank you. Please more.
Welcome.
When I feel stressed, so I go outside and roll alone. So that and I sometimes I go to park near my office. So I get break at job. So I become
You know, Muhammad, we have a little bit of feedback on your line. I'm sorry. Did everybody hear? I couldn't hear that one.
No, that was so noisy.
No, ma'am.
Yeah.
I hear a little bit of feedback. But thank you for sharing anyway. Anybody else?
Okay, I would like to share something about me also. I'm also a mother of two boys on the spectrum. You know, the one is 18 and the one is 12. Additionally, I'm working with like other kids who are suffering, who are going through the same phase. So sometimes it actually burns me out. You know, sometimes you're stuck in some situations that you feel like, okay, what I'm going to do. So what I do at that moment, I spend I spend quality time with my family, even just hugging my elder one and just lying down on bed with him and singing some rhymes and seeing him happy and smiling while I spend time with him. It's like it satisfies me a lot, and all stress goes out instantly.
That beautiful. That's it. You know, my son is grown now, and those moments of, you know, when he was younger and spending that time, even now, he's 20 years old, it's precious. And being present, somebody spoke about mindfulness earlier. Just don't children do that for us? They keep us present. You know, just playing with them and being with them is the best feeling in the whole world. And I don't have a little child anymore, but even my 20-year-old, I enjoy just talking to him. So thank you for sharing that. Very nice.
So true. Thank you.
Yes. Okay. If do I have anybody else that wants to share?
Ma'am, I have to share. I am Osma Riaz.
Okay.
Ma'am, I have and currently when I started my job with autism children, so due to workload, I usually suffer from forgetfulness.
Okay.
And some sleep disturbance. So I started to write down everything like on my phone.
Yes.
So it helped me out. And for sleep disturbances, I used to make a routine in which I have to separate my workload and my households in a different way. So it helps me to maintain my work and my home life. So I think it's a good addition in my like you can say burnout.
Yes. Absolutely.
Yeah.
I love it. I am very similar. I have to write things down also. So thank you for sharing that. And I've learned in my life that staying organized and writing things down definitely helps me avoid getting to a place where I'm too burned out. Thank you so much. Okay, let me check in. Let me see how much time we have. We're right at 7:50. So I need to wrap things up here shortly. And I want to, at this point, ask if anybody has any questions.
No, ma'am.
Okay. What I'm going to share is I have had a fabulous time. I hope I get to do it again. I definitely look forward to more talks and trainings. And again, I have never been to Pakistan. I live in Bolingbrook, Illinois. So just throughout my growing up, there's there's a very large Pakistani community here that has always welcomed me. So I've learned, about the culture growing up. I love Pakistani food, so please share recipes with me. I'm trying to learn how to make biryani. That's my favorite. So I look forward to working with you all more, and I thank you so much for your time, and I hope that the information I shared has contributed it to your life in a positive way.
Yes, ma'am. Thank you so much.
Thank you
It was
so much
very
for being
helpful.
there, and we would love you to come to Pakistan.
Ma'am.
Oh, good. Okay. Okay. Have a wonderful day. I wish you all peace and blessings, and I hope to talk to you again very soon.
Thank you so
Sure,
much,
ma'am.
ma'am.
Thank you so much for your time, ma'am. It was very
Bye.
helpful.
Bye, ma'am.
Thank you so
Thank you, ma'am.
Bye.
Bye. Take care.
Take care, ma'am.